I think they should be absolutely outlawed for every kid, at least under 12.
Yeah.
Absolutely outlawed. But using screens for parenting, I think, will be considered child abuse in the future. I think that we didn't know what we knew. We didn't know what we know now. And what we know now is that they are an abomination. And that's not a place for guilt. That is just a place for action.
Welcome to the Inspiring Families podcast with Dr. Stacy Jagger, otherwise known as Dr. Sassy, and we are delighted to have Dr. David Hasse from Maxwell Clinic.
Hey, Stacy, It's really great to be here.
So happy to be with you today. Can we start with your story?
Sure.
Where you came from, how you ended up in what you call personalized systems medicine, which is fascinating.
Yeah.
And you're the man, so I'm going to be quiet and let you talk.
Well, where it all started was there was this man and a woman, and they loved each other very much. No, not that far back.
Not that far back.
Okay, we won't go that far back.
Okay, right.
And no, I have always been fascinated with life. I love life.
You do.
I have always loved things that grow. I have always been fascinated with this mystery of why is there some things that are inanimate and some things that are animate? Why are there some things that, just sit there and other things that grow and reproduce? And so Mom said I wanted to be a physician all the way back to being a small child. I got very ill many times, and so I got a lot of contact with my family doctor who would quiz me all the time.
Okay.
And he was always fascinated that I would remember the quizzes from the last time.
And where was this?
Scotland, South Dakota.
South Dakota.
I grew up on a dairy farm in South Dakota.
Farm
And, farm boy.
Okay.
And I gave my dad notice in second grade that I would leave the farm forever and never come back. I gave him a written document.
When you were 7.
Yeah.
Okay.
And so anyway, but I was very fortunate through a long period of education to find myself at Vanderbilt Medical School.
Right.
And Vanderbilt's a wonderful medical school. They really do have a humane way of seeing medicine and a humane way of training medical students, which is really wild back in the the early 90s. But there, I actually saw 3 patients die at the hands of subspecialists because a subspecialist had forgotten about that was a person rather than just the diseases of the organ system they were treating.
Yeah.
So, and I was really shocked by that. I was like, because they're really good doctors, and that could happen.
Yeah.
So I determined to be a doctor of context, of understanding the generalism of a person. Who is this person? And not to lose that as we dive so deeply into one organ system or another.
Right.
Well, I really love medicine. I love science. So I actually ended up going to Mayo Clinic for my residency in Rochester, Minnesota. And did that in family medicine. And because I really believe the family is the ultimate. We all have family, whether or not we identify them as blood family or soul family.
Chosen family.
We have family.
Yeah.
And those people that we're closest to really drive so much of our health outcomes. So if we don't honor that, first of all, then we miss out on so much else that can happen. But I wanted to understand people from womb to tomb. I wanted to grapple with the reality of a human from the molecular to the cellular to the organ to the organism to the organ systems, the family systems. And I wanted to be that mystery of how do people fit as a system of systems has given me never-ending opportunity for learning and enjoyment. So then it was at Mayo, I started the Evidence-Based Medicine Club.
Oh.
The evidence-based medicine was just kind of coming on the scene. It was when...
What year are we in?
This was in 99.
Okay.
Yeah. No, 96.
Okay.
And doctors, when I was in medical school, I went to medical school before Google. We still had to go to the library and look up things in actual journals, looking through the Indicus Medicus. Very difficult to find information.
Right.
Information was stored in the smart human, in the guru, right? And doctors were the people for health. And then the internet started coming out, and data started to be shared more. And we started going like, well, wait a second, I don't know how to actually read a medical article. So we went back and we took multiple articles. We took 3 articles a month for 6 months. And after 18 of those articles in 6 months, I became a therapeutic nihilist. That means that I lost my belief that what I was doing was useful.
Wow.
I saw so much evidence that what we were doing, the standard of care in medicine, that we were causing harm as opposed to causing benefit, or where we thought where we just weren't creating help. Vioxx came out around that same time, was a medication that was the breakthrough anti-inflammatory. We read the data. I never prescribed it once, but it became the rage everywhere. And hundreds of thousands of people died unnecessarily of cardiovascular disease because doctors didn't read the actual articles that came out at that time.
Wow. Okay.
So I went, wait a second. I have lost my faith. I'm $250,000 in debt from going through medical school. What do I do? I was walking down a hallway in St. Thomas Hospital at Mayo, and it hit me. It was like a conversion experience. That, wait a second, I can look at all of this beautiful science. I can look at all of this beautiful information, and I can ask, what creates health? Because I saw, even though maybe our science wasn't so great and these articles weren't looking so good, people still got better.
Okay.
And were they getting better despite what we were doing? I thought a lot of what we're doing was helpful, but what part? But we weren't taking all that information and asking the question, what creates health? And when you do that, the whole world changes. But guess what? There's no money in that. There's no big pharmaceutical industry.
Sunshine, water.
Oh, but there's a lot more than that. Oh, there's precision. There's precision genetics. There's a lot that we can do with all kinds of tools. So the science of what creates health is as precise and as detailed as the science is what treats disease. So that lifestyle medicine, super important, great general ideas.
Right.
But we still see a lot of people doing those good general things and not getting the health outcomes they desire.
Gotcha.
So it's a lot.
Precision
medicine applied to the creation of health. And then that.
Fascinating.
And so that took me down the realm of holistic. I tried to find peers. Right? Who else is doing something like this? And some people in holistic medicine had some ideas. And then there's this group forming of a bunch of doctors. And that turned out to be a group I started working with. We called ourselves functional medicine. I got to be there from the very early days of functional medicine. I've gotten to teach thousands of physicians all across the world in functional medicine. I was first board certified in integrative medicine. And all these are terms. I really don't like the labels. We just really want to practice good medicine. What is it? What is it that this one human needs that will not hurt them, that they can actually access? And how do we keep asking different questions? So to finally answer your question, what we've devised is something we call personalized systems medicine as a way of really bringing in, keeping the person at the center, recognizing that person is a system of systems, that the cellular systems, biological systems, family systems, and all of those systems influence their life experience. And then for us to be curious and to be humble and really be interested in what does this person want. So let's put the life desires of that person in the center of everything that we do, and then say, what is the least damaging, most likely effective, most resource efficient way of this person getting to have an ever better human experience? That's really what it's after. And the science of that we call personalized systems medicine. And it is the biggest tent of biggest tents. I love everything in conventional medicine. I'm so glad that we have every tool, every drug, everything that we can possibly have. I want the biggest tool chest possible. But we should only use those tools when they're really needed. And we should make certain that we bias our interventions towards those things that are safest, most effective, most gentle, and most likely to have side benefits whenever possible. So there you go. That's what personalized systems medicine is.
So the birth of Maxwell Clinic was when?
That was 23 years ago. 23 years ago. I created Maxwell Clinic as a living laboratory to answer the question, what creates health? It was never really devised as a clinic. I really named it Maxwell. People ask, well, where's Dr. Maxwell? Are you Dr. Maxwell? And I go like, no. Matter of fact, if anybody really wonders who Dr. Maxwell is, I think it's the patient. I think each patient is their own Dr. Maxwell. But Maxwell, the short way of saying it is for maximizing well-being.
Okay.
But it really means that max is, I got this from my yoga practice. Max is like the inhale. It's bigger. It's when you inhale, you expand. It's more, you're making space, more, better, faster. It's the striving. But well is like the exhale. It is the soulful surrender into the moment. It is the allowing what is. It is the being. So max is the doing, well is the being. And just like life, if you just inhale, you die. If you just exhale, you die. And it has to be an oscillation amongst those different extremes, which really give us the amplitude of a high quality life. Mm-hmm. So, because we see people all the time that get caught in max. Oh man, because we do some really advanced longevity work. Mm-hmm. We are been at the cutting edge of that for ages. People ask me, well, have you heard of peptides? Dude, I've been using peptides for 12 years, right? Many different forms of them.
Okay.
We have the largest private plasma exchange center in the United States. We've been doing that for 8 or 9 years. It's always hilarious to see these things pop up on social media, but we've been doing them for a long time because I'm focused on the science, not the marketing. Okay. And so I'm really excited. I'm actually starting a podcast myself that we're going to call Ever Better Human Care.
There you go.
Ever Better Human Care.
I love it.
So that we can start actually talking about some of these things that we do. And, but yeah, it is always coming back to the human. That person's max well is what we are shooting for. What is their optimal state of body, mind, spirit that best helps them fulfill their purpose, pursue their dreams, and enjoy the journey. It is an individual definition of health. What is your Maxwell? Because health is just a term we throw around all the time and we don't actually think about it. Mm-hmm. So we have an exercise to help people step through and go like, oh, what is it you're really after? Mm-hmm. Who are you at your greatest potential?
So I was at your clinic last week with a client, and one of the things he said to me when we left is, I am so impressed with how Dr. Haase got down on his knee to get to know me personally. I think you came into the room 2 or 3 different times. And that made such an impression on him. How did you get to be such a humble, authentic, connecting human? How did you get here?
Failure.
Thank you for that.
Yeah, I think that how the hell can a doctor get arrogant? I just don't get it. Because
I don't get it.
If you're really recognizing that, and I do a lot of brain work, and when you think about the human brain being the most complex structure in the known universe, how on earth can I use words or technology, or I can measure the brain in many different ways, and we do. We take a poly-precision methodology for how we do things. So, because especially the brain. But I would say that, number one, I got in touch with my failures in medicine in my first practice. Here I came out of Vanderbilt, Mayo Clinic, kind of thought I was hot.
Okay.
And, and I came into this rural family medicine practice because
Where was this?
In Cresco, Iowa.
Okay.
And
we're in Iowa.
We're in Iowa now.
We're
in Iowa now. And that's actually why I thought I was going to medical school. I wanted to follow my family doctor and really take care of everybody. But there, I started to take care of this. I was in a town of 4,000 people with 3 other doctors in this little clinic. We were an hour and a half from any tertiary care facility.
Wow.
So it took, we did not even have our own ultrasound machine. We had to call
You're in your 30s at this point?
No, early or late 20s.
Late 20s, okay.
Yep. And I did everything there. I delivered babies. I ran our one-room ICU. I actually went out to Amish homesteads, and one time I did a forceps delivery via a kerosene lantern.
Wow.
But I'll tell you what happened is that most doctors are in this situation, when patient comes to you for help, and you diagnose, you treat, and they go on their way. And then you go to your next patient, and you go to your next patient. And sometimes the busier the doctor, the more that is the case. And then if you don't see that person back, it doesn't ever come to mind again. And in a town of 4,000, I couldn't help but see my patients back, even if I had not helped them. And so if I wouldn't see them, I would see maybe their aunt at the grocery store, or I would see their neighbor at the football game.
Yeah.
And they say, you know what, John, John, he told me he came to see you, and then he didn't get any better, so he went and did this, and he did that. And all of a sudden I was really like, wow, I have never actually had an honest feedback of how many times I missed the mark, I was not helpful, I actually didn't address what needed to be addressed. And I just decided to be honest about that and going like, damn, I'm really missing the mark. And that fueled my interest in this idea of how do we create health? How do we find and address underlying causes of illness? And if you keep focusing on the outcome as the goal, the outcome is not that I gave you the right drug. The outcome is, are you closer to your health? Are you closer to your Maxwell? Are you going the right direction? Are you getting what you wanted out of your health care? We should be intensely person-focused. And I just love humans.
I can tell.
I just love humans. I am so fascinated with the human experience. I walk in the airport and I am infinitely, I don't people watch, because I have an ability to see people's potential. I see people for who they can become. And that's sometimes a burden, but I've gotten to just recognize that that's the case. And some people I can work with and get the pleasure of working with and be on the journey with them. I can't do that for everybody.
Sure.
And I can't help everybody. Right. So I do what I can with the tools I have. And but it does come down to love. One of my patients said, he said, you know what? You practice more like a veterinarian than a doctor.
You do.
Yeah, I was like, I can't wait to hear the explanation for this one. So I can't wait. He said, no, you don't understand. All of modern medicine, all you doctors, you're all based on fear. It's all about fear, about, you have this disease and you need to watch out for this. And it's all about fear this, fear this, fear this. You go to a veterinarian and they're just focused on love. Oh, you love your pet. Oh, let's take care of this pet. You love this dog, this animal. It's a love-based endeavor. He said, the actual tools you both use, if whether you use love or fear, those can be the same, but the way they are delivered here at Maxwell Clinic makes all the difference. And I went, yeah, I'll be a vet. I'm fine with that. I'm totally good.
With it.
I am totally good. If that's what this means, then I'm in. Bring it up. Bring it on.
That's great. So, what kind of people reach out to you? I'm guessing everybody. All kind of things. But
it is.
Give me a snapshot of what that would look like. Who would be a good candidate for reaching out?
Absolutely. Well, we have a special interest in helping brains be better.
Okay.
And when I say the term brain, I think of it very metaphorically. As every one of us has this 3 pounds of mush up here in our head, and how do we understand our brain? We understand it, and it causes all of our problems, all of our symptoms, all of our awareness, even pain. That's a brain problem. It may originate somewhere in the body, but we're aware of it because of our brain. All of our symptoms get filtered through our brain. Our quality of life is our brain. If we don't put the brain at the center of healthcare, we have missed the mark, because everything is about helping the brain function better.
Okay.
And so people know that about us, and they seek us out for all kinds of issues in psychology, neurology, fatigue. We have a lot of experience in fatigue, but also neurodegeneration. I have a real passion for and I really enjoy working with Alzheimer's disease and Parkinson's disease and other neurodegenerative disorders, because they are a great example of multiple system failures. When we come in and people say, "Oh, you have Alzheimer's disease," well, it's kind of like coming upon a train wreck at the site of a train accident, and there's just everything strewn everywhere. And it doesn't take a rocket scientist to diagnose a train wreck, right?
Okay.
But how did that train wreck happen? What could have prevented that train wreck from happening? How could somebody have figured out 3 miles back that somebody didn't switch the right thing, switch the tracks correctly? How about 10 miles back, did they not recognize the engineer was sleepy? How about 15 miles back, did they not recognize that there was a couple of loose wheels? How about back at the station, did they not recognize
all the signs along the way?
So that train wreck didn't just happen.
Right.
And it pisses me off that because as soon as you start having symptoms, if you start having memory loss, and even only you know it, that is a late stage problem.
Okay.
That is a late stage problem. And then most of the time, we treat it with denial. Most of the time, well, it's not so bad. I'm just getting older. That's horse hockey. No, you're not. There's many people who go to be in their 100 years of age, and their brain is as sharp as a tack, and they're having a full experience of life. I believe we all have that capability. Now, some of us have genetics that is stacked against it.
Yeah.
Okay? And we can't wait until that symptom starts. Now, if the symptom starts, well, then absolutely dig in. Find all the component of underlying causes that address that. Treat them all. The idea that a single drug is going to fix Alzheimer's is an absolute abysmal failure of an idea. They are going to fail. Matter of fact, the Cochrane database, which is it's an evidence-based medicine database, just came out with a complete review of the anti-amyloid drugs, which are these drugs there's a couple approved by the FDA for the treatment of Alzheimer's disease. They cause a lot of brain swelling, and they very minimally decrease the rate at which people get Alzheimer's. And finally, the Cochrane database has now declared, they're of no use whatsoever. And so, but what is of use, matter of fact, we've submitted a journal article. We were one of 6 sites in a $7.5 million trial.
Okay.
I'm very committed that we have to build the science to figure out what does work. We can't just have a whole bunch of freaking marketing. We need to practice good medicine and sort out what does work in helping people. And so we participated in a very grueling trial where we brought people in that had early cognitive decline, early Alzheimer's disease, and did a very comprehensive evaluation. We did MRIs looking at, and we did computerization measuring just how how much of their brain had shrunk in different areas. We did genetic studies of very complex genetic studies, not just 1 or 2 genes, but thousands of genes that are all related to cognitive decline. We looked at their metabolomics. We did quantitative EEG brain mapping. We did measurements of little molecules that show that the brain is getting inflamed and swollen. We did assessments of their nutrition, their lifestyle, we looked for infectious disease, autoimmune disease, and then we decided, okay, which of these have the highest priority? Which of these components is causing Alzheimering? We should think of not Alzheimer's disease, but we should change it to a verb. Are you Alzheimering? Matter of fact, all of us are Alzheimering. It's just how fast are you Alzheimering? And will you die of something else before the Alzheimering catches up with you? So that is the honest truth. We're all Alzheimering, and there's many different factors that are pushing us down that path faster than we need to be going down that path. And so we did this randomized controlled trial on this, and we came out that we have we've shown that our poly-precision methodology, looking at a lot of different precision elements, has a profound effect on reversing cognitive decline. As a matter of fact, it has the largest effect size of any therapy that has ever been evaluated for this early cognitive impairment. So there's absolutely things you can do about it. We have to get this out of our head that if we're having memory loss, we're stuck, and instead be brave, be honest, and say, yep, I'm slipping, and then invest in your brain. I mean,
prevention. I'm hearing prevention.
Yeah, and early treatment.
Yeah. So say somebody just calls you and says that there's nothing wrong with me. I just want you to help me be healthier. What does that look like?
Absolutely. If somebody comes in and says there's nothing wrong with me, help me be better, number one, they just haven't had a thorough enough evaluation.
I bet.
I mean, honestly.
Truly.
People come in and they say, oh, I got a complete blood workup with my doctor.
And nothing's wrong.
I would drain your body 3 times over of all of its blood before I would call it complete. I'm telling you, we actually work with
always improve your health.
We work with over 50 laboratories from across the world. We work with research institutions. We work with cutting-edge laboratories. We have some labs that are done at our office and no other place in the world.
Okay.
Matter of fact, one of those is it's an RNA test measuring endogenous nuclear ancestral antigens of viruses that have implanted themselves in your DNA of your ancestors.
Whoa.
And it turns out that this genetic profile is one of the most amazing techniques to diagnose and understand long COVID, as well as cancer and multiple neurodegenerative diseases. Yeah, so I'm working with a researcher at the University of Iowa, researchers in Europe on this, but we're at the very cutting edge of the cutting edge. So nobody has heard about these endogenous nuclear ancestral antigens. And so, yeah, you will. And that's really going to be a remarkable advancement, because I think one blood test is going to be able to help you understand how your body's immune system uniquely responds to your environment.
Based on epigenetics.
Actually, genetics. This is actual genetics and genetic expression patterns of something called antisense RNA and antisense DNA. So we have all these very deep control patterns in the body. But anyway, the question was prevention. And I would instead say all of us have potential for greater well-being and performance and enjoyment now. Okay? I actually like to return people and ask the question, well, what % of your maximum potential do you think you're expressing right now? And I have yet to have somebody say 100%.
Got it.
Okay, so when people say I'm well, that just means in our current culture, I'm well means I'm not sick. That is a terribly low threshold.
So if I'm 70%, if I say I'm 70% there, then you measure the 30% of how I can go from 70 to 80 and 80 to 85. Yes?
Yes. And so, but I would say that it's always a matter, we're always approaching 100. Right? Because what's really fun, and you get to see this in your practice, which is wonderful to get to share patients with you.
I know.
Because you're amazing at what you do.
Thank you.
And how you work with family systems and how you bring people together and use the health of one to leverage the health of the other. And, it is a system. And when you work in one area, that's going to bring things out in others. And I see you doing that because I get to see, we've gotten to share multiple families, and that has been a joy.
Yeah, good.
That's a joy. And so, but that is the question on the prevention side. We're always, do you ever find a perfect family?
No.
Right. Okay.
It doesn't exist.
But they're all wonderful. They're all opportunities to learn, opportunities to grow as individuals.
Totally.
And so the more, and it's fun, the healthier and healthier people get, the healthier they want to be. And that's a good thing. I mean, I have two guys sitting in my chairs back in Maxwell Clinic right now getting plasma exchanges done. Because in each of them, we have found that they have elevated markers, a lot of elevated markers for Alzheimer's. Now, these are two individuals who are at the top of anybody's game, right? Anybody would consider them that they would never think that there's ever issues. But they are moving towards Alzheimer's at a rapid rate.
Wow.
And we can find that while they haven't lost a bunch of neurons.
Right.
While they haven't, started on that process of decline. And then we can be really curious because we have markers of, are you Alzheimer'ing? Just like we check things like C-reactive protein and cholesterol and hemoglobin A1C to see how healthy is your heart and your blood vessels, right? We blood markers, understand the health there. We now have blood markers for Alzheimer'ing. We have blood markers to understand where are you. And as soon as we know that, my gosh, there's so many tools. Now, most doctors, I'm going to say this, I love my physician colleagues. I think physicians are some of the most wonderful humans on the earth. And we know that our profession has been riddled with harm to patients, okay? Jumping out ahead and doing things too innovative that have potential for harm has killed a lot of people. Vioxx is a good example. We'd mentioned that before. Here's this FDA-approved medication. Shouldn't have been FDA approved. Data was just, the marketing people got ahead of the medicine people. And doctors just kind of signed on because other doctors were doing it. So we have to be very cautious about advancements in healthcare. One of my main premises is first do least harm. That we have to anchor on that first because the body, we humans are what heal. Doctors, we're along for the ride to help. Anybody is along for the ride to help focus more effectively what is more likely to be effective for you. How do you? I feel like one of my most important jobs is to help individuals apply their available resources so that they get the most bang out of them as possible, right? And everybody has way more resources than they think. Okay, people like, well, they think about money as a resource, but they also have time, they have focus, they have relationships, they have energy. There's lots of resources that we can use to change the trajectory of our health. Money helps. Absolutely. Money is a shortcut for a lot of different things, but that absolutely should not keep somebody from the other. It's just going to take more time and be a little harder if you don't have access to the shortcuts. But we all have way more potential for health than what we give ourselves. I believe we should be cultivating Maxwell. Cultivate Maxwell. Cultivate is such a great word. Cultivate is like everything around the nurturing of life, right? We should be planting the seed, tilling the soil, watering. We should be putting the seed in the right place. We should be harvesting effectively. Cultivation, the idea of changing a mindset that I am cultivating my Maxwell is so wholesome. And it takes a lot of the pressure off. It's not, are you healthy or not healthy? No. You are on a pathway. What's your trajectory is a much more important question. So we deal with people with very severe illnesses of all types.
Okay.
People come to us with all types of conditions because we're treating the human. The whole human. And so we have this fallacy. We think, oh, I need to go to this specialist because he knows my disease. No, even Sir William Osler, the father of American medicine, what an amazing, patron saint of medicine, said it's more important to understand the person that has the disease than the disease the person has. Because a disease is a made-up name. It's a code word we gave to a set of symptoms and signs, and it changes. I mean, we're constantly making up new diseases, right? Right? We're constantly doing that. Or we're changing the definition
And
of what
illnesses.
something means.
Yeah.
Right? Right? So they're not real things. They're language. They're a descriptor of something, of a pattern. But what's real is the human. What's real is our biochemistry, our anatomy, our sociology, how we interact with our environment. And I want to focus on the real. And the better we can do that, the more likely we're going to have the best outcomes with the least likelihood of harm.
Your ketamine-assisted therapy program, can we dive into that?
Absolutely.
And how you got involved in psychedelic-assisted therapies, your belief in that? Can we chat about that for just a
Absolutely.
second? Yeah. Talk to me.
Sure.
Yeah.
Well, I already said that the brain is really the center of well-being, right? And how do we do a lot of neurofeedback.
Yeah.
Neurofeedback is a way that we put a bunch of sensors on the brain. We measure the brain waves, and then we can teach the brain to have more efficient electrical patterns.
Yeah.
And we've helped innumerable people through head injuries and problems with cognition and attention and stroke recovery and migraines and seizures. I mean, it's remarkable. When you improve the electrical efficiency of the brain, that the symptoms and the signs of that can go away.
Yep.
So I always want to make sure the therapies we're doing, that person walks away with more capacity to heal.
Yeah.
Right?
Yeah.
So that they become healthier. So how does neurofeedback work? It works on neuroplasticity. Neuroplasticity, everybody out there is doing, if you're listening to this right now, you're exercising neuroplasticity because you are changing your brain. When you change your mind, it is actually a physical event. We don't think about that, but in order for you to change your mind, new little synapses need to sprout out of some of those neurons and connect with other little neurons, and those, in some pathways, get strengthened and other pathways get weakened, and you are physically changing your brain in order to change your mind.
Yeah.
That's why people who are biologically healthier can also adapt faster in life as well. That's why mental health has to take care of biological and physical health as well. So we're a package deal, right?
Yep.
So psychedelics. I mean, there's a tremendous amount of data around psychedelics, and we've seen more information around psilocybin and LSD and MDMA-assisted therapy. And some of those are just now becoming legal. They're just going through the FDA process. Many of these compounds have been taken off the market and vilified unnecessarily. Listen, every compound has a potential for harm or a potential for good, right? I actually think all of therapies can be divided into three things. You either a therapy is a medicine, meaning it creates health.
Okay.
It's a drug where it creates control.
Okay.
Or it's a poison where it creates harm.
Got it.
I think everything is one of those three things.
Okay.
And depending upon the dose and the circumstance, it can be any of those three.
Got it.
Okay? Ketamine, absolutely. If you're an idiot and you take a bunch of ketamine and you hop in a hot tub and you go unconscious and slip under and you drown yourself from it,
it's not good.
That's deadly.
Right.
Okay? That's a poison.
Right.
Ketamine we use in the ER all the time to control pain. If people come in with a broken, kids, we use ketamine all the time. It's our preferred anesthetic agent in the ER to knock a kid out and make them unaware of their pain so you can reset a bone or you can put an IV in or something that needs to be more traumatic. But we're using ketamine as a medicine. I want to create health in the process. And I like calling ketamine the unstuckifier.
The unstuckifier.
Unstuckifier.
Love it.
Thank you. TM. But the unstuckifier is because all these psychedelic compounds actually work via neuroplasticity. They make the neurons more flexible. They cause neurons to fire that have not fired before, or to be in relationship one with the other in ways they haven't been before. And then new ideas come forth, maybe old memories come forth. You get access to different and more parts of the brain than you had access to without those compounds. And so ketamine, we use it in our clinic in a very controlled environment. I mean, you got to see. We take these medicines very seriously, and when used in the right hands, unbelievable transformation can take place. So we give our ketamine IV, and when you give ketamine IV, you can control the rate exactly. You can dial it up, you can dial it down. If the experience is too intense, you bring it down. If it's not enough, we bring it up. Where ketamine can be used, and there's other trials using it in other ways, like intramuscular or intranasal. Intranasal, there's some really good studies has been done. There's an approved drug in the market for that. But it's kind of unknown what's going to happen. You have little control, and so ketamine can be very useful on its own. We provide a very safe space for that with an RN there. We monitor the vital signs, so those are very safe. So you can really relax, know that you're safe, do your mental work. And then there's a job of now new understandings, new awarenesses have come about. Then you require integration. You have to bring that new understanding, that new work into your life and figure out, well, okay, now how do I move forward? And it can be profound. But one thing that really up-levels ketamine is being able to work with a therapist in that space. And so it's been wonderful to watch you work in that space because with individuals that want very much to break through, they want to get unstuck. And they have the heart, they've been doing the work, they've been going to therapy, they're doing the exercises, and they just can't break through. This is an amazing therapy for that. And I'll let you speak to the psychotherapy part of it, but we really believe in creating a very safe, controlled container so that that person knows that, hey, whatever's said in this room stays in this room, that they don't have to worry about their body. We got their body. There's a nurse always there. We take a very intense approach to this because I kind of think of it, like psychological surgery. Right? We have to take that level. We have to honor that person, and everything is about making it safe biologically, safe spiritually, safe psychologically, and then amazing things happen. I have gotten to see lives changed at levels that nobody would believe. People who have been chronically addicted to so many substances, and they're like, I don't want to use ketamine because that could be addictive. I said, there are some people who use it in an addictive way. In the way we use it, I don't think that's going to be something that's going to go that direction. We've certainly have never seen one of our patients, turn to the recreational use of ketamine. But anything's possible. But if you're coming to it with the idea that I'm using this to heal, it's a very useful compound. And the number of people who have been able to let go of addictions as a result of utilizing ketamine are profound. So, when the psychotherapy, what was it like sitting there?
When I'm working with a client and I feel like their record, there's the part of the record, it just keeps skipping, and I just want the rest of the record to play. That's when I intuitively, as a clinician, know this might be a great opportunity for you to experience ketamine-assisted therapy so that the rest of your record can play. And that's what I find really in integration is that they come back and they're able to process things from, being able to see it from a wider lens view, and just the record continues to play. They can move on with the next chapter instead of feeling so stuck. And there's all kinds of things that I've tried brain spotting and EMDR and neurofeedback, all the things. But when the record won't continue to play, that's when I say, why don't we try this?
Absolutely.
So thank you for opening the door for my people to come.
Yeah.
And experience. Yeah, absolutely.
I like to say that we are the solution, not Maxwell Clinic, not you. All of us, each one of us are the solution.
Yeah.
We are our solution.
Right.
And the people, every one of us is the solution for someone else. We all need each other. Our number one value at Maxwell Clinic is we are Maxwell. We really do not believe in isolation.
Yeah.
We believe what is the best
Connection.
Therapy for this person at this time?
Curated for this human.
Yeah. We don't have a mill of anything. It frustrates the business people in my clinic. And they're like, can we just do more of one thing? That would be a lot easier. And I'm like, yeah, but it wouldn't
curated.
But it wouldn't be taking care of that person at the best level that we possibly could. And they go, okay. And it's so funny because so many of our employees started as patients.
Yeah. Oh, wow.
And so many of them have had their transformation, saw that, oh my gosh, I'm not stuck anymore. I can move through. And that's one of the most that makes me feel good in a way that we see that we can not just heal humans, but heal healthcare. Because I feel very passionate that we are here to transform healthcare into something more, something I call human care. And how do we embrace each human at the center and recognize that our medical treatment industrial complex, this 20% of our GDP is just healthcare. And a lot of that is just administrative money, shuffling things around. You can have healthcare, no, you can't. And there's a whole bunch of barriers to it. And then that adds cost on to everybody. And it's a non-sustainable system that has to fundamentally change. Getting more insurance, more health care is not the way. We have to have better health care. We actually have to make it more efficient in the actual delivery. And so we actually built a software platform called Ever Better. And so we're really excited. Probably by the time this podcast comes out, people will be able to download their Ever Better Me Life Data Vault.
Nice.
This is where the first time ever people are going to be able to own their healthcare record.
Wow.
I think you need to own your data, right? None of this business of it being stuck in this clinic or that clinic or this hospital. It's yours. It's yours. It's your life. It is the record of your life experience, which is a sacred event. Your life is sacred. There is nothing. It is a holy, divine thing. I don't know how anybody explains themselves. I'm constantly amazed at, oh my gosh, I'm alive. I'm aware. I'm a bunch of molecules and cells that happens to be aware of itself. That's wild.
Miraculous.
That's miraculous, right? And so that is precious. And our data is as precious. That is the record of our life experience. And that data is valuable. It's really valuable. All the other companies know that. Google harvests our data, Facebook, everybody is, I call it human data trafficking.
There you go.
Right? Because people are taking that. And I think we need to own our data. And when we own our data, now we can have authority. Now we can work with our data. And then now this pairs with AI. I totally strongly recommend don't put your medical records into an AI system, okay? You are unleashing things you have no idea what's going to happen. The number of and I want AI to be really helpful for people, but you got to make sure that it's a safe compartment. I mean, I wouldn't trust some of these AI companies to save my life, but I'm a physician. My job is to exercise fiduciary duty on the part of my patients and to protect them. HIPAA is a joke. I mean, HIPAA is such a low standard of privacy. It's ridiculous. Somebody says, "Oh, it's HIPAA certified." No, that just means anybody that has a HIPAA entity can share your data with almost anybody else who's a HIPAA entity. So we need to retake our sovereignty as human beings. And
Amen.
we are
Amen,
sacred, we are
bro.
sovereign, and we deserve better. So
Wow. Okay.
I got a little passion around
You
this.
sure did.
Well, it's because that's what medical practice has done for me. And the deeper you know humans and you know human suffering, and you go like, the problem is the system. And the people in the system are beautiful. Clinicians, doctors, nurses.
All of them.
I call them all healers.
Totally.
They're just healers.
Yeah.
The people who want to expend their life force for the betterment of another human. That's a healer. And healers and the humans that healers want to serve are caught in a fragmentation machine that is basically monetizing their suffering as opposed to really coming alongside to help. And I think we are all the solution. You're the solution. I'm the solution. Everybody listening to this is the solution, and we can do it together.
David, I want to speak really honestly with you about my passion for children and the amount of screen time that they are currently engaging in. So about 15 years ago, when I was early in private practice, before that I was in community mental health. But because my husband and I lived in a non-electric cabin completely off the grid for 18 months in our early 20s, after I had been raised in a very violent alcoholic home, my nervous system regulated on the front porch of an 1850s cabin for the first time in my life. And the walks that I went on and experiencing nature, walking 3 miles a day with my sheepdog Max and hanging out with the Amish. I worked with the Amish for a little while. Simplifying my life, really experiencing life completely minimalize. Is that a word? What's the word? Minimal.
Is now.
That word. Yes, it's a word now. Fast forward, then I'm sitting with families sending me multiple children of theirs, and they're asking me to work with a whole family system. And I knew that the one thing that I could do because of that experience was to inspire this family, many, many families, if they would remove their children from the overuse of screen time for about 30 days, that I could really allow what was really going on with the family to bubble to the surface. I could really look at what was really going on in that family system without any distractions, and could allow that family to heal in a record amount of time. And so because of digital detoxes that I've been implementing with families for many, many years, I am extremely passionate about this idea of advocating for children, Washington, D.C., and here in the state of Tennessee, to allow people to understand what a detriment this is to the health of our country, our world, especially in the pediatric, population, but all of us really. Can you talk about the benefits of digital detoxes from a medical standpoint? Can you talk about the importance of nervous system regulation with health outcomes? Dopamine, cortisol, the amount of ADHD symptoms that are being created because of the fast frames per second of the shows and the YouTube reels and the Snapchat and the Instagram and oh my gosh, like you can't even keep up with all of it.
Right.
And just the idea of health around the fact that screens are going nowhere. They're here to stay, including AI. How we can use this as the dessert of our lives to benefit us, but for us to not be slaves to our phones and screens. This is really a conversation that I'm having with my clients, with families every day, and now advocating from a public health standpoint.
Yeah.
Maybe we can chat about this until we wrap up. I would love to just hear from your perspective, from a health perspective, all of what I just unpacked. This is really what I feel like is the hill that I'm going to die on. This is how I volunteer my time when I take days off to go to Capitol Hill or go hang out with Marsha Blackburn or whatever. My book, 30-Day Blackout, that I wrote a number of years ago, just came out with the second edition. Dr. William Sears, who is a beloved pediatrician, wrote the foreword to the book, and he's very supportive of my work, as you are too. But I'm going to zip it now.
Well,
And I want to hear you talk. And maybe we can banter back and forth about this issue from your
I hope you don't
perspective.
zip it. I hope that this is a profoundly important topic. Okay, profoundly important. I don't think you can advocate more for this. And it's so let me take the neurologic angle to this,
Great.
okay? Because
Great.
I think you're taking great in the family systems, you're seeing what's happening. But if you understand what happens in the brain, then I think it becomes absolutely imperative that we all take screens very seriously.
Yeah.
So let's just think about two systems in the brain. So you have two big systems in your brain. One is your attentional system, and the attentional system, says, okay, this is important. Pay attention to this, because right now you're not feeling maybe the weight of your feet on the floor. You don't feel how wet your lips are until I mention it. Now all of a sudden, oh my gosh, my lips are wet, right? So your attention system is always kind of surveying the world around you, saying, this is important. Pay attention to this. Super important part of the brain. It helps us survive. And if that attention network is not working very well, it's hard to get around. Okay? Then there's a second part of the brain. We call it the default network. And I've been studying the default network, probably I did my first lectures on the default network 15 years ago. Oh gosh, almost 20 years ago now. And the default network is this amazing area of the brain that got named that because when they were doing early functional MRI studies and they're trying to figure out what part of the brain does what, they would say, okay, lay in this functional MRI and think of the color green. Okay, part of the brain would light up. Great. Now wiggle your left toe. Okay, now the different part would light up. Okay, now hum the Pledge of Allegiance or whatever. I don't know. And a different part would light up. But every time in between what their task, and they had the break time, a different part of the brain, the default network would light up. They just started calling it the default network because every time you weren't intentionally doing something, this part of the brain would light up. And it turns out that default mode network, or that default network, consumes more energy than any other part of your brain. And it's a very important part of your brain. It's always answering the questions of identity. It is answering the questions, who am I? Where am I? How am I? It is letting you know you're okay. It is interpreting the world in light of your context, because you're not the same person when you show up at a cocktail party as when you show up at a clinic, as when you show up at church. Your default network is constantly adjusting your identity to the circumstances. It's very important. And when that default network is disrupted or not active, anxiety comes about. You don't feel right in your own skin. So the two parts of nervous system regulation that are very important is regulation of this default network and regulation of your autonomic nervous system, which would be your sympathetic and parasympathetic and your adrenal glands. So those are the two main areas that have to regulate in order for you to have a good quality of life at baseline. Okay, lots of context there. Okay. Now, I want you to take your right hand and your left hand and lace those fingers together. Your right hand is your attention network. Your left hand is your default network. Okay. They lace together. Turns out when one of these networks is on, the other one is off. They are very separated from each other except for a very small amount of crossover. And so when you're paying attention to something, you're not thinking about who you are, where you are, and how you are. Okay? When you're, and you can imagine that a child maybe in a home that's disrupted, or they don't know who they are. They don't know if they're safe. They don't know what their value is in their life system. They've maybe been pummeled with a whole bunch of messages from the internet that they're not enough, they're not beautiful, they're not this, they're not that. And that default network does not have a good definition that feels safe and calm. They don't feel calm inside their own brain. How do you turn off that anxiety? You pay attention to something. And guess what really grabs our attention more aggressively and effectively than almost anything else? Screens. Yeah. Screens. Bright colors, flashing lights, changing circumstances, grabs our attention network. And because we're paying attention to something, that little small voice in the back of our head that says things aren't right around here, doesn't get heard.
Wow.
And so we're using our attention network to numb ourselves about what's really going on, our lack of connection to other people, our insecurities about ourselves. But the problem is those screens scream a whole bunch of messages that want to make sure you don't go back in that default network. They scream, you are not enough. You are not beautiful enough. They use things like anger and vice and anything that's going to grab your attention. And because the brain adapts, it's something that grabs our attention on day one will not grab our attention on day two as much, and less again on day three, and less again on day four. So in order to keep our eyes coming back to those screens, things have to become more wild, more edgy, more taboo, more wrong, more bright, more loud, more everything. And that part of our brain just gets overworked. But guess what? It doesn't get trained to pay attention to things. It's being overused so much for attention that when the screen goes off, that part of the brain is exhausted.
Yeah.
It is exhausted.
Yeah.
And the part of the brain that's been sitting there resting for a while is the default network. And the default network's going like, oh my God, who am I? Where am I? How am I? I don't know. I'm not attached to anything. I'm not connected to anything. I don't know who I am. I don't know where I belong, because you haven't been putting the time in to do that. And what causes that? What creates that default network being healthy and happy? It's being connected to people. It's actual relationships. It's a relationship with a higher power.
Right.
It is a relationship with something that is meaningful to you. It is relationships are the centerpiece of that default network. Relationships with time, with place, with people. And so screens are an abomination. I think they should be absolutely outlawed for every kid, at least under 12.
Yeah.
Absolutely outlawed. But using screens for parenting, I think, will be considered child abuse in the future. I think that we didn't know what we knew. We didn't know what we know now. And what we know now is that they are an abomination. And that's not a place for guilt. That is just a place for action. And we have to because there is the law of compound interest. And we think about compound interest being important in monetary terms, and it is nothing compared to compound brain function. Because when you get a new function in your brain, guess what? Now that new function, you get to take it into tomorrow, and you get to use that brain function, and it builds upon that brain function. And so day three, you've got all the things you built from day one and the stuff you built on from day two. And you now compound your brain function. So the good news is the right time to start changing screen time was, 10 years ago. The second best time is today. And so recognize we are all manipulated by this digital environment. It's one of the things we're trying to work with Ever Better. It's an app, but it's actually an app that is not focused on stimulating you and getting you back in and gamifying everything. It's instead focusing you back on what is important. Have conversations, to bring out what is actually important. So when you're working with a child that is struggling in any aspect with attention, with mood, with connection, with aggressive behavior, the screens have to go.
Period.
They just have to go. And I'm not, it's not an option, because when we do neurofeedback, so I've been talking about screen time for a long time, because when we are trying to retrain brain's electrical activity, And these are like 20 to 30 minute episodes where people are actually looking at a screen, and we're using the screen with light and sound to help retrain certain electrical patterns in the brain. And then that kiddo goes and plays, 8 hours continuous of video games where there's constant reinforcement. It's very hard to get progress.
Totally.
It's very hard to retrain a brain when you have this monster amount of input that's coming on. And for when we initially get exposed to something that tickles our attention network, we get a surge of dopamine. And dopamine is there to help us know what to do again. And so dopamine is somewhat a pleasure compound. But what's amazing about dopamine is that the more we juice dopamine, the more dopamine it takes to get juiced again. And it guaranteed. And this is why the first bite of a meal is almost always the most pleasurable one, right? Mm-hmm. Your brain immediately adapts to say, oh, that input was important and pleasurable, but now we better turn down that so you pay attention to other things in your environment. So dopamine addiction is the addiction. It is the addiction. And the only treatment is withdrawal. You cannot keep juicing the brain. You just can't. And dopamine detoxes, thank you for being such a strong advocate of them. All of us need to be very mindful of our digital diet. And AI the more information AI has about you, the more it's going to trap you inside its extraction economy, the attention economy. Your minutes are actually what are being mined. And the more information you give AI about yourself and don't have that information for yourself to battle it, the more attention is going to be extracted from you. So it's an act of claiming your personhood to leave the screen as much as you can. It is an act to grow a life. Go out, get outside in nature, spend some time with people having difficult conversations, look people in the eye, give an extended hug. Mm-hmm. It's hard. You haven't exercised those muscles, but you can do it. And the benefits are unbelievably awesome because feeling good inside your own skin is freaking awesome.
Priceless.
It's awesome. Life is awesome. And if you're not experiencing life as awesome, know that you can. You are not stuck forever. It's going to take work. You're going to have to rewire a brain. You're going to have to go through some pain and some detox. It's worth it. It is worth it. And we have to advocate for people who are so caught in their addiction that they can't do it on their own. And parents, I just hope parents really hear this because we're the boss. Parents, it is our responsibility. Our child's brains are our responsibility to care for. And limiting screen time, removing screen time, all of those are going to benefit not just your child, but it's going to benefit you. It's going to benefit the relationships you have with each other. It's going to enable that child to be the more complete version of themselves. You're going to give the gift of that child to themselves. They will start to enjoy themselves more, to be at peace and at ease with themselves. Not going to happen overnight, but through neuroplasticity, through rewiring their own brain, we can develop a new sense of self. And thank you so much for your ardent work in this. It's profoundly important.
This reminds me of cigarette smoking in the 70s and 80s, when everybody was smoking or non, and there was, even in the non-smoking, that you could see billows of smoke.
9 out of 10 doctors choose Camels, right?
And I quit. I tell my clients I quit smoking when I was 9. Yeah. I used to steal my daddy's Cool Light 100 menthol cigarettes when I was in 4th grade.
Can I just say the power of brain wiring that you can rattle off the exact brand? right?
There you go. I'll never forget it.
Because you got a big hit.
That's right.
You got a big hit. Man, and we'll talk another time about mitochondrial function and addiction, because that's a whole nother rabbit hole that's fascinatingly interesting. But go on. So, yes.
So with the screens and children, and then we can wrap up with this, but you can't take your child to a porn store. You can't take your child to a strip club. But you can give your kiddo these iPads and iPhones where there's pop-up windows with their games that are very benign games, with parents that are extremely busy and overwhelmed with parenting and working and all the things. And parents are not aware that their children are stumbling upon all kinds of extremely inappropriate material. And what breaks my heart the most is the fact that there are clip-in iPads in strollers now, where the baby can scroll an iPad instead of looking at the mother's eyes.
Yep.
That there are babies scrolling their hands because they're looking for the dopamine, but they can't get the screen back, and they're literally, David, they are scrolling their little infant hands trying to get that feeling. Can you, and then we'll just wrap up, can you talk about the potentially irreparable damage to an infant, to a toddler, to a young child that is engaging in that much dysregulating screen time? And then maybe talk about how we can reach your clinic at the end of our little time together. And thank you so much for our chat today.
Yeah. Well, so the brain is tremendously plastic, and I believe there's dramatic potential for healing always.
Thank you for that piece of hope. Thank
always,
you for that.
Okay?
Yes.
Always.
Yes.
However, the brains develop like compound interest. So a child, we know that keeping children on their back is a problem, because we want to prevent sudden infant death syndrome, so keep your child on their back. Well, but the child needs to roll over, because when you're on your tummy, then you raise your head up, that spinal activation is actually a fundamental building block. And then when the child looks around left to right, that's another building block they learn. And then they learn to push themselves up. That's another skill. And then they get up on all fours, and then they start to crawl, and they go left, right, left, right, left, right, left, right. And they are wiring the source code for the program that's going to run their life long term. So the early childhood development, we know this with premature infants that don't get a lot of cuddling, or don't get as much contact, or have early childhood delays. Anything that happens early in childhood really feels the brunt of the lack of compounded brain function development.
Yeah.
So the earlier in life that someone is limited from experience, and that's one of the things. It's not just that's horrifying to think of a baby, of a child, repetitively stimulating, thinking, okay, I need to get more stimulation because I don't feel comfortable in my own brain.
Right. When
instead, that should be a signal to cry out to mom and dad and be held,
right,
and be, give them the comfort that you belong, you are wanted, you are important.
I see you.
I see you. Yeah. Those are things that, and if we didn't get those as a child, guess what? As adults, we get to reparent ourselves.
Right.
That's part of ketamine therapy. That comes back to there again, right? If we didn't get it as a child. So if the children don't get that, they're going to have a much harder path long term.
Yeah.
Okay?
Yeah.
And I totally believe that everything is grist for the mill. Okay? Everything is grist for the mill. But it is responsible as adults who now know the science and the toxicity. Can I go back to our three things? The screen can be medicine, it can be a drug, it can be a poison. And it's always one of those three things. That's a core of our Maxwell understanding of things. But most of the time for a child, the screen is absolutely not a medicine, I can't find an idea when it would be. It's very frequently a drug when the parent wants to shut the kid up and make sure that it's a drug for the parent. And I know that's a hard thing to hear, and some people are going to be pissed off by me saying it. Fine. I hope it does make you angry, because there's something there if it made you angry. Or it can be a true poison. It is limiting that brain's flexibility cognitively. And the children are our future. The children are our future. Yeah. We should judge our society by how many smiles does it put on the faces of children. That's a really good marker. Are we going the right direction or not? Is it making a child smile? So if you have a goal in your life, help a child to smile. Do anything. Give them a little, give them attention. Encourage them. Say, man, that was a great job. Oh, wow. You're kind. Give a child some encouragement. Watch their face light up. Get a dopamine surge from a child's smile.
Yeah.
Let's change the economy of being human back to one of the things of greatest worth is the smile of a child. And do what you can to mine and to create more of those. That is a life well lived. Man, you're on your deathbed and you're reviewing your life. I hope all the smiles of children that you enabled pop up for you. That's ever better human care, right? That we care for ourselves and we care for others. So I believe it's where it's going.
Thank you for being here with me today.
Absolutely. It's a joy.
Thank you for sharing your wisdom and your experience. Where can we find you?
Our clinic is Maxwell Clinic. You find maxwellclinic.com. You'll also be seeing a lot of Everbetter. Everbetter app will be available probably by the time this comes out, and we're very excited to see ability to give people sovereignty over their data, to be able to own all of their data, and then be able, once you own it, then you can do something about it. But Maxwell Clinic, we're here in Nashville, Tennessee. We love taking care of people and be honored to play a part in anybody's life.
You're a delight. Thank you.